Hi guys, welcome back to my channel. This is Dr. Rajeshwar from yrpharmatube. In the previous video, we discussed the succinimides type of anticonvulsant drugs. If you did not watch the video, hit the I button on top right of this video to watch it. To watch the other topics of anticonvulsants and the other subjects of pharmaceutical sciences, click on the links given in the description box below this video. In this lesson, we shall learn about urea and monoacylurea type of anticonvulsant agents and their specific individual drugs such as phenacemide and carbamazepine. At the end of this video, you will be able to understand the urea and monoacylureas type of anticonvulsant agents and the specific individual drugs such as phenacemide and carbamazepine. Before looking at acylureas or monoacylureas, let us know about the urea, which is a group present in the monoacylureas. Urea is also called carbamide or carbonyl diamide because it is a diamide of carbonic acid. Thus, it is sometimes known as isourea. The amide has two amino groups joined by a carbonyl functional group. It is thus the simplest amide of carbamic acid. It is a monocarboxylic acid amide and a one-carbon compound. It is functionally related to carbonic acid and a tautomer of a carbamimidic acid. It is a compound mainly produced by the deamination of amino acids in the liver. Urea is the principal end product of protein metabolism and constitutes about one half of the total urinary solids. Thus, it is the main nitrogen-containing substance in the urine of mammals. Urea appears as an odorless, solid white crystals or pellets. It is highly soluble in water and practically non-toxic compound. Its LD50 is found to be 15 grams per kg body weight for rats. It is widely used in fertilizers as a source of nitrogen and it is one of the important raw material for the chemical industry. Acylureas. Monoacylureas are those compounds that contain only one acylurea moiety in their structures. Acylureas are also called N-acylureas or ureides. They are a class of chemical compounds formerly derived from the acylation of urea, thus the name acylurea. A subclass of acylureas are also known as benzoylureas, which are insecticidal compounds. For example, diflubenzuron, flufenoxuron, hexafluoran, lufenuron, and triflubenzuron. All of these act as insect growth regulators by inhibiting the synthesis of chitin, resulting in weakened cuticles and preventing molting. The acylurea functional group is found in some pharmaceutical drugs such as anticonvulsants, phenacemide, phenytouride, chlorphenacimide, and acetylphenytouride, which are phenylureides. And the sedative drugs include acecarbromal, bromisoval, and carbromal, which are the bromoureide derivatives. Other acylureas include apronal, capuride, and ectylurea. Acylurea related compounds include barbiturates, a class of cyclic ureas, are structurally and mechanistically related to acylureas. The phenylureides are also closely related to the hydantoins such as phenytoin and may be considered ring-opening analogues of acylureas. A diureide is a complex nitrogenous substance regarded as containing two molecules of urea or other radicals, for example, uric acid or allantoin. Hydantoin or glycosylurea can be considered the cyclic form of acylurea. By considering 2-phenylbutyrylurea as an open-chain model of phenobarbital, Spielman and his co-workers in 1948 investigated more than 50 non-cyclic acylureas structurally resembling the anticonvulsant barbiturates and the hydantoins. Barbiturates are malonylureas However, like the hydantoins, they also contain an acetylurea moiety as part of heterocyclic ring system. Two of the straight-chained acylureas, phenacemide and phenaturide, were really found to exhibit good anticonvulsant properties in animals and were mainly introduced into the therapy of psychomotor attacks. Phenacemide was introduced as a therapeutic agent in 1951. However, dangerous side effects including personality changes such as suicidal tendencies, depression, aggressiveness, hepatic damage, and blood dyscreasis have led to its limited use. It is still used in patients who have become refractory to other agents and is useful particularly in psychomotor epilepsy. Phenaturide was shown to be active against electroshock but not metrazole seizures. Clinically, it has been effective in grand mal and petit mal, and reportedly good results have been obtained in psychomotor epilepsy. A variety of disubstituted phenylbutyrylureas were synthesized and tested for anticonvulsant activities. The anticonvulsant activity in guinea pigs was less than that of phenaturide itself. Structure-activity relationship studies of acylureas. Among aliphatic acetylureas, the highest anticonvulsant activity is found in those derived from branched chain acids of about 7 carbon atoms. With a further increase in molecular weight of the compound, the anticonvulsant activity gradually terminates and hypnotic effect predominates. Phenacemide is most active agent among the aromatic acetylureas. Any substitution on the nitrogen of phenacemide does not increase further the anticonvulsant activity. The activity decreases with aromatic substitution of phenacemide with a gradual increase in hypnotic activity. Diphenylacetylurea is found to be inactive compound. Phenacemide. Phenacemide is also known as phenylacetylurea. It was introduced in 1949 for the treatment of epilepsy but was eventually withdrawn due to toxicity. It is an anticonvulsant of the ureoid or acetylureas class. Its IUPAC name is N-carbamyl 2-phenylacetamide. It is a congener and ring-opened analog of a phenytoin, that is a hydantoin, and is structurally related to barbiturates and to some other hydantoins. It is a member of acetamides. Phenacemide is synthesized by reacting or acetylation of urea with phenyl acetyl chloride with the elimination of a molecule of hydrogen chloride. It is a solid and its crystals occur from alcohol. It is a white to practically white fine crystalline powder. It is odorless and tasteless. It has melting point at 215 degrees centigrade and is very slightly soluble in water, slightly soluble in alcohol, benzene, chloroform, ether, and slightly soluble in acetone. When heated to decomposition, it emits toxic fumes of nitrogen oxides. Phenacemide acts on the central nervous system to reduce a number of seizures. It binds to and blocks neuronal sodium channels or voltage-sensitive calcium channels. This blocks or suppresses neuronal depolarization and hypersynchronization. Hypersynchronization is what often causes seizures. Phenacemide is sold under the brand name Phenurone. It is an effective anticonvulsant that may be useful in generalized tonic-clonic, absence, and mixed seizures. It should be used only therapy of temporal lobe epilepsy refractory to other agents in association with other drugs. Another drug of acylurea derivatives is carbamazepine. Carbamazepine may also be considered as a urea derivative. Carbamazepine was discovered in 1953 by Swiss chemist Walter Schindler in Switzerland. It was first marketed to treat epilepsy in Switzerland in 1962. Its tricyclic structure resembles that of the several other psychoactive drugs. It is also an immunostilbene derivative. Its IUPAC name is dibenzazepine 5-carboxamide. It is a dibenzoazepine, that is 5-H-dibenzoazepine, carrying a carbamyl substituent at the azepine nitrogen atom. It has a role as an anticonvulsant, a mitogen, a glutamate transporter activator, an antimaniac drug, an analgesic, a non-narcotic analgesic, an environmental contaminant, a xenobiotic, a drug allergen, and a sodium channel blocker. Synthesis of carbamazepine. Two molecules of 2-nitrobenzyl chloride undergo self-alkylation in the presence of a base, that is sodium amide, forms a dinitro derivative. This dinitro derivative is followed by a catalytic reduction, gives diamino intermediate compound. Subsequent N-acetylation takes place upon reacting with acetic anhydride and collidine to form N-acetyl dibenzazepine. This is then on treatment with phosgene and ammonia yields the desired product carbamazepine. Carbamazepine is a white or almost white crystalline powder that is practically insoluble in water. Mechanism of action of carbamazepine. Carbamazepine is a sodium channel blocker and it binds preferentially to voltage-gated sodium channels in their inactive conformation, which prevents repetitive and sustained firing of an action potential. Carbamazepine has effects on serotonin systems, but the relevance to its anti-seizure effects is uncertain. There is evidence that it is a serotonin releasing agent and possibly even a serotonin reuptake inhibitor. It has been suggested that carbamazepine can also block voltage-gated calcium channels, which will reduce neurotransmitter release. Carbamazepine is sold under the brand name Tegretol. It is an anticonvulsant medication used in the treatment of epilepsy and neuropathic pain. It is used as an adjunctive treatment in schizophrenia along with other medications and as a second-line drug in bipolar disorder. It appears to work well with other drugs such as phenytoin and valproic acid for focal and generalized seizures. It is not effective for absence or myoclonic seizures. It is used in the treatment of generalized tonic-clonic and both simple and complex partial seizures. This is the list of references followed for the lesson. That's all in this video. The urea and monoacylurea derivatives of anticonvulsants and individual drugs such as phenacemide and carbamazepine. In the next lesson, we will discuss about the benzodiazepines type of anticonvulsants. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.